Well, hey everybody. Hey Matthew, how are you this morning?
Doing good, Teepa. How are you?
Well, I'm in Florida. You wouldn't know that if you looked out the window. It is raining and it is cold. You wouldn't know it from the thermometer either, because they're expecting a cold week with a possible freeze by Friday. I'll only be here today, but this is a disappointment.
Yeah, you went from the cold hoping to go to a warm place. And
I'm really glad I didn't bring my jacket. I almost didn't. I thought, I probably won't need it. I'm near Tampa, you know. You know what else? Emilio tells us all the time how it's warm and wonderful and sunny. And it's like, yeah, well, not today. So anyway, I'm going to be in Wesley Chapel area, and I'm doing a program. And so it's for the community, and it's sponsored by a group called, and this is an interesting group. They're called Beach House Wireglass. And I think it's part of a group that really does want to make a difference. And so my host is Bonnie. And so I'm looking forward to it. And I've already met somebody at the hotel who's coming. And so I was like, that's when I was going down to figure out, where did I lay those keys when I checked in, the keys to the vehicle? Because I checked in between 11:30 and 12 last night. And, so I was checking in. And now, Matthew, do these look like keys right away?
No, they do not.
They do not. And I had my backpack, my carry bag, my suitcase, and one other thing. I can't remember what the other thing was right now. And so, it was 4 things. So I should have been able to keep up with that 5th. But usually I wear pants with pockets. But it so happened I did this trip without pants with pockets. And boy, was that a mistake. So guess where those keys got laid?
On the countertop yeah.
Yep, it was right where I was checking in. And because I wanted to get a snack and a drink out of a little shop there, because it was late. And, of course, airports now, everything's closed. Everything's pretty much closed, or there's a long line and you only have a short window in Atlanta to get from one flight. So anyway, enough of Teepa's whining. It's going to be a good day. It's always a good day when we can do something of value. It was a little bit, yeah. I'm out. Yeah. Fortunately, the keys were right there. I said, did anybody turn it? Oh, yeah. She pulls open the door. Here they are. So, how many other people did you have check in after 11:30? Am I quite done whining? No, but oh well. Let it go, Teepa. So things are good. And we're back to our discussion. Now, yesterday we did the Let's Reimagine launch, not a launch, but announcement of a launch, which is coming tomorrow, later in the day, a little later in the day. But today we're back to our topic for the week. And the topic for the week is the second part of our series on after the diagnosis. And this section is for the care partners or people who are in support or professionals or people who are looking around, but they aren't the primary who did the diagnostics. They're the person who's trying to figure out, what do we do next? But they're not the person living with dementia either. We're going to do that next. So what we talked about last time is unfortunately what typically happens. So there's lots of stuff that happens typically. And what we want to talk about is what are some better options. So I'm going to throw up my slide, because I've been working with slides. And the reason I was working with slides is this all came about, quite honestly, because, Matthew, let's see. Do you sort of recall why I got into this at all?
Yeah, Teepa, we started to talk about covering this part of healthcare professionals and what happens after they get the diagnosis. And because we had so much interest, you could tell so many folks out there were like, wow, yeah, oh my gosh, this is what's happening. It was kind of like a light bulb moment for us. Like, oh my gosh, we tell the story from the healthcare professional, the physician giving the diagnosis. Well, what about, let's talk about the care partners and the caregivers and the professionals in that side. And then also look at from the perspective of somebody who's living with dementia, when it comes to right after the diagnosis, where do we go from here? And so that's where we came up with the idea, was just that initial that initial covering of, okay, physicians giving the diagnosis.
Yeah. So if we have an individual who's going in to get a diagnosis and they're all on their own and the physician does this, I mean, wow, they're all on their own again. And the physician is doing, or the medical provider is doing whatever they've been doing before. And this person is now standing there going, I have what? Or, oh my, I thought, yeah, now what do I do? And so recognizing the value and the importance of a support person. So, and often there is a support person because sometimes the reason the person is coming in is because of the support person. And so what we're going to talk about here is not leaving the person out of this, but really looking at this person's possibilities. What could they do differently after the diagnosis? Just like what could the doctor do differently or the health provider do differently after the diagnosis? That might make a difference. And so it came from a talk I did at UNC Hospital, doctors and providers who were really curious. I mean, they wanted to hear from my perspective, at least, what should be different. Because, I mean, I think some things should change for them, but then also for all of us, because we're not going to change the care until we change the culture. And the way to change the culture is to make choices that are different. So here we go. I'm going to share my screen now. Because of course, when I did it for the group, I had to, of course, have slides. So here's my take on for care partners or caregivers, what would be better essential next steps? Now, you're going to see some similarities, but you're also going to see some differences. So the first thing I think a care partner or a caregiver or the other person should do is pause, just call a pause. I think to be able to say, whoa, man, doc, you really just surprised us. Or Matthew, wow. So you think you're thinking what's going on is some form of dementia. Wow. Okay. So that's news. And what I'm going to ask for is, I'm going to ask us to pause for a second. And I'm going to turn to my person. I'm going to say, so how are you feeling? Do you want to hear more right now? Or do we just need to pause right now? Because this is a real surprise. Because we need to find out what just happened. Was there an explosion or was there an acknowledgement or was there a disbelief? Until we figure out how am I doing? How are you doing? Going forward doesn't make a lot of sense. So I think once you pause, I do think one of our really strong possibilities for next steps is to say, you know what? I want to set up a return visit and I would either want to meet with you. If you feel like this is an area of skill for you, we would want to meet with you. Or I would really like to meet a skilled person who's going to be able to help us now that we've gotten our syndrome identified. Now I'm going back to our syndrome identified unless we got a specific type of dementia recognized, because this goes back to why were we coming in the first place? Because, was it another medical condition? Well, she has diabetes, but I think what's really causing the problem is her dementia. And it's sort of like a sidebar. It's like, she's not taking her meds like she should. And it's like, wait, what did you just say? Because sometimes quite honestly, it gets thrown out like that. So that pause, whoa. So you're thinking the issue that we're having is not exactly just the diabetes. You're thinking it's something more than that. Okay, well, I need a pause here. That idea, pausing really is an essential element of developing your skill as a care partner. Being able to say, whoa, hang on here. Let's pull the reins back. You delivered a bombshell. You surprised somebody. You are not talking to the person. You're just talking to me. Pauses can be used for a variety of reasons, but calling a pause is something that we want to get comfortable with and saying, wow, whoa, mom, dad, John, wow. What did you just hear him say, her say? Checking in. And then deciding, is this a good time to move this forward or do we need a real pause for right now? That's number one that I think goes on my hit parade of you just got the info. So hitting the pause button before you go anywhere and asking for a follow-up support. And that's when you want to really process. You're going to be doing some processing before then, or you're going to be figuring out some things before then, but you need a break. The person needs a break. It's possibly going to have been a lot just doing this. So The second is to consider asking for a pharmacy consult to evaluate everything before you add or change anything. Really asking, for this specialty person to look at all the drugs, all the meds, all the things the person might be taking, doing, because quite often, unfortunately, people may not be aware of everything the person is on because they don't want to mess with it, or they don't want to touch it because, well, they're also seeing a urologist and they're seeing a cardiologist and they're also seeing somebody for Parkinson's. And it's like, well, then let's ask for the expert who does know a lot about how these things might intersect and interact. It's their primary focus, their primary job. So a geriatric pharmacist who is really interested in looking at the whole person and all the bits and pieces. So for me, that's, before we move forward, let's get a baseline. Let's sort of look at where we are on all this. And sometimes I might be the one who's really wanting a fix. And so I have to really catch myself and go, okay, I got to get a baseline before I ask for a fix, because that's just sort of like a drug addict asking for something else because I just want relief. And I get it, but it's not a helpful thing if we're not even sure where we're standing right now. And the third is to actually make a seek. So ask for a seek. I'm seeking a referral. I'm seeking support for education, for connections. I want to know, I need somebody or an organization that is very knowledgeable and skillful in this area called dementia. I'm going to need that. Frankly, I need that. So we need it. We're going to need something beyond this doctor's visit, beyond this PT visit, beyond this driving eval, whatever it was that got this started. I would like something different. So I'm going to pause there because those are my core ones. So Matthew, what you thinking?
Yeah, Teepa, the pause piece especially, I think how important that is, because so often when you get news, and we talked about this on our last part, right? That part of physicians giving that recommendation, but it is truly a powerful piece when you're noticing this is overwhelming. And is anything beyond this point really going to matter? Is it really going to help that person in that moment, continue to give them more information, or do we need to stop and then we need to process just that part now?
The emotional part, the physical part, the relationship part. I mean, there's a lot to really wrap your head around once you sort of get the idea that this is a life-changing condition here. So that means my life is going to change. Their life is going to change, but potentially so is mine. I just got info. That means, yep. Wow. Okay, this relationship isn't going to be a quick fix relationship. I can't just adjust the volume and then walk away and think they'll turn the TV set off when they're ready, or they'll be able to do this. Because what I heard is the problem with the diabetes, for instance, or the Parkinson's meds is that they're not taking them like they should. And it's like, okay, well, that's going to take something more than just giving them a new prescription. So really looking at this stuff harder before we move forward, including who's in pain, who's in discomfort, who recognizes what this means, and who's really not aware of in the same way of what this might mean. And so, then we have some additional things, so we need to really think about what I know and what I need to know to accurately and effectively support. So how does the person living with feel about the info, and what can they hold on to? What symptoms are present that are causing some issues for the person or for me or for what's going on? And where are we in the progression of change? I mean, where are we really? Are we in the very beginning, or we're actually in the middle, but we just heard that we're in this? And we've got some reflection to do about where we are really. What are the person's retained abilities? What do they still have going for them? And what's changed, and how has it changed? Is it consistently not there, or is it inconsistently there? So knowing what do they have? So this is this assessment that we're doing during this pause. What's the pattern of ability, disability being noticed? What do you notice about this pattern? what support systems do you have in place and what isn't there? I mean, what do you have out there for support already? And what do members of the support system believe, know, understand about dementia? I mean, what do they know about this new thing you just heard about? And finally, what are the two options? What are two things you want to look at or try for right now? Because we believe in limiting things. So there you go. Whew. What do you think?
And Teepa, I'm curious too, this piece, after somebody gets some news that is very stressful, cortisol starts to dump and all of what that does to our ability, anybody with a brain's ability to process, to take in data, to do things skillfully. That idea too of trying to give that person some time before you start looking at, okay, what are they able to do? Because realize that when they are under stress immediately and in that time frame as well, that some of those abilities are going to be challenged even further because of that stress.
Especially if they did their very best during that eval. Yeah, and you were going, man, why are they doing so? They shouldn't be doing this well. They don't do that all. And that idea that they're putting on a show, no, they're not. Their brain did the best it could, but now it's empty. So we really have to be careful now because, wow, this could plummet quickly. And this is not the time to throw everything on the table and emergently try to do something. So this is where, how do you think I can come up with this kind of list and know when to implement it?
Yeah, I have a feeling, Teepa, after, what has it been, 40 plus years again of you doing a lot of this stuff and experience and helping and consulting with folks, you've had the opportunity to experience a lot of this and see a lot of this and help support folks.
Yeah. And so guess what? I am one of those people that should be that return visit person, someone like me who sees beyond the diagnosis or the condition or the syndrome and talks about how we're going to live life now, guys, because that's really what we're looking at. What's the game plan? But before we have a game plan, I got to know the team. Who's on the team? What's the team abilities? But we need to pause and then we need to recheck in with our quarterback and our coach and we got a lot of work to do here because we just found out we're in a whole new ballgame in many cases, or we were playing, but we didn't realize that's what was going on here because it's not a game, it's life. So I'm going to pause this here because I think that was a lot to digest. Now we will be putting up the slide set. When we finish our series, those will be up and you can go and look at everything because we do want to make that available to folks. So when we finish the next two we have, because we have two more to go, we'll finish these last two for this part of the series and we'll post up then the PowerPoint for this entire 4-part segment. Yeah, cool. Well, Matthew, I think we've done enough for today. What do you think?
Yeah, I think it's time now for that pause that we've been talking about and let people process and take in what we talked about. And then, we'll move forward after we've had some time to digest it. Well,
and realistically, it's time for me to get going to go do this program that I'm supposed to be doing before too long because I have commitments too. And the reality is you can only handle so much of something before you need a break anyhow. And it's a really healthy thing to do for your brain. Know your limits and know what your time limits are and know, sometimes taking a break is not a bad thing. Just making sure everybody's in an okay place before you do it. So Matthew, you doing okay?
I'm doing okay, Teepa.
All right, everybody. Take care with care. And we will be back again tomorrow to do our next segment. Take care, all.
Bye, everybody.